Hello, my name is Karen, and I'm a nurse here at the hospital, and I want to thank you patients, for being here today for this patient safety class. Safety is important, and we want to keep you safe, and especially falls. We want to try to prevent falls because most of them are preventable. So we want to be proactive and implement things that we could do to prevent those. So we did some research. Nurses have access to many different large databases where studies are done, and out of those studies, they give us evidence of what works and what doesn't work. So this evidence that they give us is called evidence-based knowledge. And today we're going to turn this evidence-based knowledge into evidence-based practice. And that just means we're going to put that knowledge into action. And how we're going to do that is we're going to implement a new plan to try to keep you safe. And it's called Purposeful Patient-Centered Hourly Rounding. The evidence shows us that it improves quality and safety and makes patients have better outcomes. So we're going to implement this, and what will happen is a nurse will come around about every hour to see you, and they will identify any safety risk that there might be and explain and implement safety measures. For example, we usually try to keep the bed in the lowest position and the side rails up. We have safety socks with treads on the bottom, so that helps prevent you from slipping, because sometimes our floors are kind of slick. Also, we help patients that might not be able to get out of the bed or move around. Maybe we reposition them every hour in the bed to help prevent pressure sores. And maybe someone just needs help using the restroom. Or maybe somebody needs help walking, so we'll get a walker and a gait belt and help that patient walk. So all of these things will happen during the hourly rounding. We'll also make sure that you have all of your personal possessions within your reach so that you don't have to reach for something and risk falling out of bed. We'll also give you your nurse call light, and that call light is for emergencies. The nurses will be making hourly rounds, and if you think you have emergency in between those rounds, then we're going to have a call light for you that you can push, and it'll tell us that you need help right away because you're having an emergency. So we'll make sure all of those things are within your reach. The evidence shows us that hourly rounding reduces falls, increases safety, decreases pressure areas. It also increases communication. One way that we increase communication is each of you have a whiteboard in your room. And on that whiteboard, the nurses, as they change shifts, will go over with you the plan of care for that shift and also any goals that you might have for the shift. For example, maybe you're having a lot of pain and your goal for that shift is to try to get that pain under control and reduce it so that you don't hurt so much. So every hour, the nurse will make sure that you have the medication you need and when the next medication might be available. Maybe give you ice packs or heat packs, or raise your arm or your leg, elevate it, and just different things that we can do to help manage that pain. So other things that might happen is that we will teach you and educate you during this rounding. Let's say, for example, you have a wound and the wound has a pump with a drain, and we come in and change the dressing and empty the drain. So we're going to be teaching you and educating you on how to do this, and eventually we're going to let you help us, and then you'll do it and we'll watch you and make sure you're doing it correctly. This really helps you for management of that wound at home, so hopefully you feel confident and you can take care of it without any questions because you will have already done it here. So by doing that, that evidence also shows us that this hourly rounding engages you in your own care and teaches you how to take care of the things that you'll need to take care of at home. The evidence also shows that the hourly rounding reduces anxiety, because most patients have a little bit of anxiety and apprehension when they're in the hospital. And so knowing that we're going to be coming around within the hour really helps to settle patients down. The hourly rounding should always increase your hospital experience and your hospital satisfaction, because we're taking care of your needs on an hourly basis, and it improves the nurse-patient relationship. One other thing that it does is it reduces hospital readmissions. So because you're educated and knowledgeable in your home care, there's less of a chance that you'll have to be readmitted for something that maybe otherwise you wouldn't understand. One last thing I'd like to say about hourly rounding that the evidence shows us is that it increases the nurse's ability for time management. When a nurse has a set of patients and that nurse can make plans on when each patient is going to be visited and rounded on, that nurse can take supplies, medications, information, and any other equipment or anything that the nurse might need during that round. So it really does help the nurse to manage that time more effectively. So in summary, the evidence shows us that hourly rounding is purposeful and patient-centered, and it increases safety, it increases quality, and it increases the ultimate outcome of your hospital visit. Your care is so important to us, and we're continually researching and learning new evidence-based knowledge so that we can put that knowledge into practice, just like this hourly rounding. Our ultimate goal is to promote health and safety and well-being to you and your family. Before we go today, does anyone have any questions? Okay, good. Well, before we stop, I'm going to be giving you these handouts. And what these do is helps with your transition home. So they'll just tell you some helpful things to do at home to be safe, so that hopefully you'll not have any falls there either. And one last thing that I really feel like no safety education class could be complete without first talking just a little bit about the coronavirus, also called COVID-19 pandemic. It's important for you to be safe during these times, so I encourage you to listen to the authorities and follow their instruction. We need to do everything that we can to keep this virus from spreading, and so we need to continue our social distancing. Always wash your hands frequently with warm, sudsy water for 20 to 30 seconds. Never touch your face, your eyes, or your nose, or your mouth, because that's the way the virus can be transmitted. If you do need to touch your face for some reason, always be sure to wash your hands just immediately prior to doing that. Also, never just cough without covering your mouth. That sends all of those bacteria, viruses, or whatever's making you cough into the air, and that's not good to do that. You need to contain your cough. However, don't use your hand, because when you use your hand to cough and then you touch a surface and then someone else comes back behind you and touches that surface and then touches their face, that's how the virus is transmitted. So you do want to cover your cough. If let's say you're out somewhere and you don't have a cloth or something to cover your mouth with, you're not wearing a mask, the best way for you to cover your mouth in that situation is by the inside of your elbow, like this. By doing that, it keeps the cough right there in the middle of your arm where you're not likely to touch until you can get home and wash your hands and clothes, and that should help keep you safe. If you do have any symptoms of this virus, which the primary ones are cough, shortness of breath, and fever, contact your primary care provider right away and follow the instructions of that provider. You can always get up-to-the-minute information on the virus and what's happening and what the authorities are giving as instructions by looking at the Centers of Disease Control and Prevention website. That's CDC for short. And that website is www.cdc.gov. Thank you again for being here. I really appreciate you doing this, and hopefully we can all be safe during these times. Thank you again. Take care.